All right, let's dive into this one, folks. Ever looked in the mirror and thought, why are my gums white? It's not exactly a dinner party conversation starter.
Definitely not. But trust me, it's something worth paying attention to.
Absolutely. And you know us, we love digging into these health mysteries, especially when we have a juicy article like this one you sent. Why are my gums white? No beating around the bush here.
Straight to the point.
Yeah.
And one thing to remember right off the bat, healthy gums are pink, not white.
Exactly. So if yours are looking a little pale, don't just ignore it.
It's a sign your body might be trying to tell you something.
Right. And this article doesn't waste any time getting to the bottom of it. They break down the potential causes into three main buckets. The first one that jumped out at me, anemia.
Anemia, yeah. You know, it's more common than you might think. Basically, it means you don't have enough healthy red blood cells floating around.
And those red blood cells are kind of a big deal, right?
Huge. They're packed with hemoglobin, which, quick science lesson, is a protein that contains iron and carries oxygen throughout your body. It's what gives blood that vibrant red color.
Ah, so when you don't have enough hemoglobin, things start looking a little less vibrant.
Exactly. Less hemoglobin, less red pigment, and that can show up in your gums, making them appear paler or even white.
Makes sense. But here's where it gets really interesting. This article dives into some causes of anemia I never would have guessed. It's not just about not getting enough iron in your diet.
Oh, not even close. Things like celiac disease, Crohn's disease, even sickle cell disease can mess with your red blood cell count.
Wow, I had no idea those conditions could be linked to anemia.
Yep. And a lot of people don't realize that celiac disease, for example, can affect how your body absorbs iron.
Really highlights how interconnected everything is. Something's up with your gut, and suddenly your gums are changing color. It's wild.
It really is. And it's a perfect example of why this kind of deep dive is so important. Sometimes a seemingly isolated symptom can point to something much bigger going on.
For sure. So let's say you're looking in the mirror, noticing those pale gums, but you're also feeling totally wiped out, maybe a little short of breath, and your skin's looking a bit off too.
Those are all classic signs of anemia for sure. If you're experiencing any of those along with the white gums, definitely time to give your doctor a call.
Definitely. It's better to be safe than sorry. Okay, on to the next potential culprit. And this one sounds a little more intense. Leukoplakia.
It can sound scary, I know.
Yeah.
Basically, it's when you get these thick white patches inside your mouth,
Or
usually on your gums, your tongue, inside your cheeks.
And unlike thrush, which I know we're going to talk about later, you can't just rub these patches away, right?
Exactly. They really adhere to the tissues.
Okay, so what causes these stubborn patches to show up in the first place?
Well, that's the million-dollar question. Honestly, we don't have a definitive answer yet. Research is still ongoing. But there's a strong link to certain lifestyle choices, namely smoking and alcohol use.
Ah, yeah. Not exactly known for their health benefits, are they? And this is where it gets a little unnerving. The article uses the term precancerous to describe leukoplakia.
Right, and I'm glad you brought that up because it's important to clarify what that actually means.
Yeah, it definitely sounds a little scary.
It can, but it's not a reason to panic. Precancerous doesn't automatically equal cancer. It just means the cells in those white patches are showing some abnormal changes.
So it's more like a yellow light, not a red light.
Exactly. It's a sign to pay attention, get checked out by a dentist, and not ignore it.
Makes sense. So if you are a smoker or drinker, or hey, even if you're not, and you notice these persistent white patches in your mouth,
Don't wait. Schedule an appointment with your dentist.
they can take a closer look, see if a biopsy is needed, and monitor any changes over time.
Exactly. Early detection is key. Now, before we move on to the big one everyone's probably wondering about, leukemia. Leukemia. Yeah, it's the one that tends to pop into people's heads when they hear about any kind of blood-related issue.
Totally. It can be a scary thought. But
Yeah.
the article did mention that it's actually not the most common cause of white gums.
Definitely not.
Hmm.
But it's still important to understand what we're dealing with here. So leukemia, in the simplest terms, it's a type of cancer that affects your blood cells, specifically the white blood cells.
Okay, and white blood cells are the ones that help fight off infections, right?
Exactly. They're a key part of your immune system.
Ah.
But with leukemia, the production of these white blood cells gets all out of whack. They don't develop properly and can't do their job effectively.
And since our gums are full of blood vessels and tissues,
Any problems with your blood are likely to show up there.
so with something like anemia, we're talking about paleness because of low hemoglobin levels. But with leukemia, the whiteness in the gums could be caused by something else entirely.
You got it. It could be an overgrowth of those abnormal white blood cells building up in the gum tissue. that can lead to inflammation, swelling, even a change in color.
The article actually mentioned a case where a woman's white, swollen gums were a key clue in diagnosing her leukemia. It's a good reminder that a trip to the dentist can reveal so much more than just cavities.
Absolutely. Now, it's important to note that white gums alone aren't enough to diagnose leukemia, but they can be a piece of the puzzle.
So what other symptoms should people be on the lookout for, besides those white or pale gums, of course?
Well, unusual fatigue is a big one. Unexplained bruising or bleeding. Frequent infections. If you notice your lymph nodes are swollen, that's another red flag. And any unexplained weight loss should always be checked out.
It's better to be safe than sorry.
100%.
Yeah.
Especially with these kinds of symptoms. If you're experiencing any combination of what we've just talked about, definitely don't wait. Get in touch with your doctor right away.
Okay, good advice. So we've covered the big three: anemia, leukoplakia, and leukemia, all potentially linked to those white gums. Before we move on, though, we have to circle back to another possible culprit, and one that I know a few people who've dealt with personally: thrush.
Ah, yes, oral thrush. That's actually a pretty common fungal infection.
I always forget that it's fungal.
It's easy to do. We usually associate thrush with those white patches that show up on the tongue, inner cheeks, even the gums.
And you can actually rub those patches away with thrush, right? Unlike the leukoplakia patches we talked about earlier.
Exactly. That's one way to tell the difference. Although it's best not to self-diagnose. Always leave that to the professionals.
Wise words. But yeah, with thrush, those white patches can be rubbed off, and underneath you'll usually see red, inflamed tissue.
It's actually an overgrowth of a type of yeast called candida, hence the name oral candidiasis.
Makes sense. So many different things that can cause those white patches, it's kind of mind-blowing.
Right. It's like a whole different world inside our mouths.
It really is. But hey, on a more positive note, the article did say that most causes of white gums are treatable, so that's good.
Exactly. And the treatment really depends on what's causing the problem in the first place. Like, if it's anemia from not getting enough iron, your doctor might put you on iron supplements or suggest some dietary changes.
Right, right. And I'm guessing the treatment for something like thrush is totally different.
Oh, yeah, completely. Thrush usually clears up quickly with antifungal medications.
That makes sense. So, bottom line, if you're seeing those white gums, don't panic, but don't ignore it either.
Exactly. Make an appointment with your dentist. They can figure out what's going on and get you the right treatment.
They're like detectives for your mouth.
Huh.
Yeah.
I like that. But seriously, dentists are your best resource when it comes to anything and everything related to your oral health.
100%. And speaking of oral health, the article did emphasize that good daily habits can go a long way in preventing these issues in the first place.
Absolutely.
Plus-
Brushing twice a day, flossing daily.
Basics.
They really are. And don't forget about using an antimicrobial mouthwash. Those could be super helpful too.
And I'm guessing what we eat plays a role too.
Big time. Just like the rest of your body, your mouth thrives on a balanced diet. Plenty of fruits, vegetables, lean protein.
All that good stuff.
Yep. And try to limit those sugary drinks and processed foods as much as possible.
Solid advice. It really is amazing how those everyday choices, the foods we eat, how well we take care of our teeth, can make a world of difference, not just for our oral health, but for our overall well-being.
It's all connected.
So true. Well, I think we've covered a lot of ground today. White gums, they might not be the most glamorous topic, but hey, it's something we all need to be aware of.
Absolutely. And hopefully our deep dive today has given you a better understanding of the potential causes, the importance of seeking professional help, and most importantly, how to keep those gums healthy and pink.
Couldn't have said it better myself. So next time you're staring in the mirror, remember what we talked about today. And if you're ever unsure about something, don't hesitate to reach out to your dentist. They're there to help. Until next time, everyone.
Take care.